Hello, everybody, and welcome to another interview episode of the UF Care Center at the University of Florida. My name is Oliver Grundmann, and today I have the pleasure of speaking with Dr. James Otis. Dr. Otis, welcome. Do you mind introducing yourself?
Yeah, thank you. So I'm James Otis. I'm a faculty member at the Medical University of South Carolina in Charleston. And my lab studies the neurobiological basis of substance use disorders. We've been focusing primarily on opioids and alcohol, but also have interest in other substances as well.
It's awesome, and obviously fits right with the major theme and the major guidance that UF Care is working on in terms of research and educating the public as well as medical professionals. What actually got you into the field of substance use disorders and drug-seeking behavior? What's kind of your background story, so to say, your origin story?
Yeah, I think there's a long explanation there, so I'll try to distill it. But I think as a kid, I was around a lot of people who used drugs of abuse, and had both family and friends who have been afflicted by substance use disorders. And I myself, I think, was always worried that I would fall into a substance use disorder. Simply because I liked things like alcohol. And so I decided to study it. And I think that has really helped me to understand substance use disorders and those who suffer from those diseases, and has helped me inform others on how you might overcome such diseases, and also has allowed for a really exciting sort of brand of research where we're trying to help those folks.
That is such an interesting background. I do think that a lot of folks who get into the field of substance use disorders have either a personal connection or just a very intimate connection with what it means to have a loved one or friends who have a substance use disorder, or grow up in a community where substance use disorders are prevalent. It's kind of interesting. I'm originally from Germany, and coming here was kind of, there's this unique connection between people and drugs in general, but it seems to be that especially the US are somewhat unique in regards to how people connect with drugs in many regards. I don't know if that has been your observation as well.
Yeah, I think so. It's always a little dangerous to ask how people got into research involving SUD, because like you said, most people have intimate connection of some kind. And, coming from a very blue collar rural area in the Midwest, drug use is rampant and really affects those communities in a major way, and much like other rural communities outside of the Midwest. So, I think it's something that is really important to me, and is really, important to others who are from the same areas. And it also is exciting. I think there's a lot to learn about substance use disorders, and a lot more that we can do therapeutically, and hopefully our research and other research involving SUDs helps with that.
So obviously you decided to get into this field relatively early on, and you are now actually at the center of, or kind of studying the fundamentals, the underlying pathways of how somebody may seek out or develop drug-seeking behaviors and the underlying substance use disorder pathways. Can you talk a little bit about that?
Yeah, so I think understanding substance use disorders starts or should start at a very basic level. What we see in the clinic is a very complex disorder that manifests itself in very different ways. There can be genetic contributions that either predate drug use or may be caused by drug use. And so to really understand the neurobiological basis of substance use disorders, we come from sort of the perspective that we need to be able to actually control drug use and look at how the brain behaves, so to speak, before and after different drug experiences. And so one of the things that my lab really focuses on is how do brain circuits control behavior in sort of a healthy setting, so in animals that aren't drug experienced, and how do those same circuits that mediate different behaviors like reward seeking, feeding, how are those adapting because of drug use to either allow for drug use or to initiate drug use in a very hyper-functional way. And so that's sort of the perspective we come from.
So you used the phrase adapting to drug use. Mm-hmm. Is that kind of what you observe when you look at neuronal circuits, or what changes? Because adaptation kind of means that, for me, I kind of interpret it as something changes in the environment, right? And then the body or your neuronal circuits react to it. So how kind of what kind of changes are you looking at primarily?
Yeah, that's a great question. So I'll just give you a recent example. So for a long time, we've known that patients with substance use disorder have a hard time inhibiting behavior. So if you actually give non-drug related behavioral task, so for example, a task where they have to initiate a response, but then if they get a cue, they have to immediately withhold that response. It's called a stop signal task. Patients that have drug experience often are unable to withhold responses quickly and are far worse at performance as compared to healthy individuals. And so for a long time, it was wondered if that deficit, what we call behavioral disinhibition, so the inability to stop, preceded drug use, or if it actually followed drug use. Was it caused by drug use? And what we recently found is that there is a circuit for behavioral inhibition. So it mediates the inhibition of natural sort of motivated behaviors. And this is a circuit from the thalamus to the nucleus accumbens. And what we find is that if you give animals even one dose of heroin, this inhibition circuit adapts. So there's plasticity at the synapses that regulate behavioral inhibition, that allow for what we call disinhibition. So it weakens those synapses, it weakens behavioral inhibition. And after long-term drug experience, and we recently published this for heroin, but we have data suggesting the same thing for alcohol now. So after long-term use of those drugs, that circuit becomes persistently, if not permanently, dysfunctional, in that the synapses are weaker, the activity in that circuit is reduced, and we think that this causes the disinhibition that is observed not only in our animal models, but in those clinical studies that I mentioned before. So we think that behavioral disinhibition is caused by adaptations in circuits, and that those adaptations are really what cause persistent drug seeking and sort of the debilitating effects of substance use disorder.
But you pointed out, and this was interesting, you kind of posed the question whether this kind of disinhibition happens before drug exposure or after, and it sounds like it happens after drug exposure, right?
Yeah, at least in our animal studies, that's what our data suggests, is that opioids or alcohol can pretty immediately cause changes, so adaptations in these circuits that disinhibit behavior. It's actually pretty interesting. So if we give a single systemic injection of an opioid, animals will immediately and profoundly seek out even natural rewards despite the presence of what we call a behavioral suppressor. And that could be, in animal models, the smell of a fox or a predator. It can be despite previous learning that no reward is available. It could be despite really strong stressors, where normal animals will not seek out rewards in those conditions, but if you just give a single injection of an opioid, they will. And so it suggests that things like therapeutic opioids, where you give an opioid to relieve pain, can actually really strongly disinhibit behavior. And that could actually lead to behaviors that a person wouldn't normally perform, like using drugs more often.
So, and I don't want to go too deep into that, but I think it's interesting that you mention disinhibition and then reward seeking. So if an animal has not experienced drug exposure, and they would then not seek out the reward under threatening conditions or stressful conditions, an animal that is disinhibited because of the drug exposure would still want to go for that reward. So one could imagine under non-stressful conditions that the reward-seeking behavior upon disinhibition would even be stronger then, right?
Yeah, absolutely. So you're saying if the behavioral suppressors weren't around, basically. Yeah, I think that's a really good question. We haven't tested that in our behavioral models, but that is likely the case, yeah. It's interesting. I mean, when we get into drug use, I think most people understand that there's really strong reasons not to use drugs. You have addiction liability, liability related to being intoxicated, whether it's legal or just doing something that you shouldn't. You have the risk of overdose, and I think the public sort of understands that. And so generally speaking, when people use drugs, there are known behavioral suppressors that should at least somewhat dampen that. And I think the important thing that some of these studies are uncovering is that, using, at least with opioids, using an opioid one time can really change a person's perspective, we assume, based on these animal studies, of whether or not drugs should be used more. The suppressors don't, at least in animal models, have strong of a inhibitory effect. And so if this is true in humans, you can imagine that those things like the risk of overdose, societal consequences, legal consequences, they might not matter as much. And to me, that's a really scary thing, especially when considering how many people are prescribed opioids. We're testing if this is true for acute alcohol exposure now, but I think we all know that our behavior is greatly disinhibited when we use alcohol. I can't tell you how many stories I've heard of somebody doing something stupid because they were drinking alcohol, right? So one thing we're really excited about is seeing if that's related to this circuit that we've been studying. And I think some of these data hopefully will inform the public that using things like prescription opioids could have more consequences than you might think.
I think that's like I mentioned earlier to you, it's like the holy grail, right? We want to kind of get to the point where we understand what actually changes on the neuronal pathway level, that kind of then leads in the is expressed as behavior, basically, right? Changes in behavior, and how can we potentially impact them down the road as well? How these neuronal pathways are changed based on drug exposure. So I think this is fascinating work. In regards to how you see your work moving forward, already kind of talked about a 10-year kind of where things are going, or within the next 10 years. What do you think are the major barriers that your research is facing, and what are some of the major incentives for you to move forward?
Yeah, so I think there's some really exciting avenues that we're interested in sort of pursuing, but that do have some barriers. You know, in the context of the study we were just discussing, what we've found and what I didn't mention is that if you give, if an animal takes heroin or another opioid in a chronic way, and you see this behavioral disinhibition, this weakening of this thalamic circuit, what we found is that you can actually repair that circuit, at least its activity, through optical and chemogenetic strategies that you basically can't use in humans, at least not yet. So very invasive. But we find that if we do repair those circuits, drug seeking basically goes away. So the animals won't seek out drugs. And so that's really exciting to us clinically, you know, and leads to the obvious question of, can we find mechanisms to basically repair these circuits in the absence of a very invasive strategy? So there's a few things that we're doing right now to see if we might be able to accomplish this. The first thing that one of my graduate students is working on is something called ultrasound, where he uses ultrasound to activate a deep brain structure. And the benefit of ultrasound is it can penetrate tissue and hopefully target a very small and specific deep brain structure. And so this is something he's developing in mice to start with. And if that works, we're hoping to move it on to more clinical trials. But again, that's sort of a long game. You know, it might be 10 years before we really resolve whether that works and whether we can apply it to humans. Another thing that I think is really important is that whenever we're doing these studies, the first thing my lab usually does is we record activity in the brain. So, for example, here we're recording thalamic projection neurons, and we see how they change their computations in response to drug use. And we see that in this case, a lot of the neurons become inhibited, they have less activity, and we think that that is what's causing this disinhibition. But an important feature of that is that there are select cells, even though this is one brain structure and one projection, some of the cells show this inhibition and some of the cells don't. So if we look at this thalamic region known as the paraventricular thalamus, it is molecularly heterogeneous. So different genes are expressed. They have unique signatures. And because of these unique signatures, we think that these, what we call ensembles, these groups of neurons, might be targetable through different molecular strategies for therapeutics. And so one aspect of my lab right now is focusing on identifying unique molecular targets that would allow for very specific manipulation of this circuit for development of therapeutics.
And it's fascinating. It sounds a little bit almost futuristic, right? That we could really narrow it down to a particular set of neurons, basically ensemble neurons that are similarly structured versus anything else that's in that brain region. It's fascinating. Okay, so I ask you about barriers as well. What do you see in general as a barrier to furthering your research and the field of substance use disorder in general?
Yeah, that's a great question. I think there are a lot of barriers. I think one of the biggest barriers right now is taking advantage of the really transformative technology that's sort of arisen in neuroscience over the last 10 to 20 years. So we have all these wonderful approaches like two-photon calcium imaging and single-cell optogenetics and RNA sequencing that can be really useful for understanding how discrete cell types, discrete ensembles or groups of neurons contribute to behavior. But I think one thing that has been a big hurdle is applying those approaches in a way that's really informative for understanding the neurobiology of substance use disorders. And so some of the hurdles are just related to basically integrating the really exciting big data neurotechnologies to substance use disorder research. So one of the things that my lab is really focused on is making behavioral models of substance use disorders simpler. So one of the things we've done is we've created a mouse model of drug self-administration, which is sort of the gold standard of SUD preclinical models, but we've made it in a head restraint, a head restraint model. And so what that means is that we can apply really challenging approaches like two-photon imaging, which requires the head be fixed in place, to this rigorous SUD model. And so I think development of simplified behavioral strategies like this will really improve our ability to integrate new technologies with preclinical research for substance use disorders.
I think there's a lot that will likely come in the next few years, even as we talk about machine learning and AI. When you talk about big data, how can we sort through tons of data that we generate and make sense of it and kind of boil it down, simplify it so that we can better grasp it and remove the noise from the actual signal that we're seeking out or what we're seeking out. Well, thank you, Dr. Otis. This was a fascinating interview, and I really appreciate you taking the time. I am really excited to see what's coming out of your lab in the coming months, years, and to see how we further can explore behaviors based on neuronal pathways.
Thanks so much for having me. I look forward to visiting.
And this was the end of this U of Care podcast. I hope you join us for a future podcast. Take care, everybody.